I'm Dr. Howard Koh, Assistant Secretary for Health for the U.S. Department of Health and Human Services. And I'm here at the 19th International AIDS Conference in Washington, D.C., the largest AIDS conference in the world. And I'm absolutely delighted to be here with a wonderful leader, Toni Young, who's Executive Director of the Community Education Group. Toni, welcome.
Well, thank you, Dr. Koh. It's a wonderful opportunity to spend some time with you again.
Great. I know you were very pleased that the Secretary visited your organization and actually mentioned your leadership in your organization in her opening plenary here, so that's great.
You know, I think after doing this work for nearly 25 years, it was one of the crowning moments.
That's great.
I think, but the accolades, frankly, go to our staff. We are doing a great part of the work for 065 in our Linkage to Care program. And for folks that don't know what 065 is, it's the treatment, the testing Linkage to Care study that is being funded by the National Institutes of Health. And the NIH is really looking at whether or not we can incentivize folks to get tested, have them be linked to care, and then have them be retained in care. And so one of the great things is that we have a 95% linkage to care rate.
Well, that's so impressive. Tell us more about Community Education Group and not only that project, but other services that you have for people with HIV.
Well, Community Education Group actually was originally started as the National Women in HIV/AIDS Project, and we changed our name in 1996. In 2005-2006, we began to scale up HIV testing here in the District of Columbia. And so in Ward 7 and 8, which is east of the river, Ward 7 and Ward 8 are 96 and 98% African American respectively. We do a massive scale testing program targeting heterosexual African Americans here in the district. As we kind of know now, we can end this epidemic, and the way we can do that is by testing the appropriate populations, linking them in care, but maintaining them in care and getting them back in care when they're lost to care. So that's a big piece of the work that we do. We also did a big project this year called the Road to AIDS 2012, which was really about the Affordable Care Act, the National AIDS Strategy, and leading up to AIDS 2012, where we went to 17 cities around the United States to have conversations, to have community dialogues with folks about where they were with the National AIDS Strategy, where they saw integration between ACA and the National AIDS Strategy leading up to the conference and actually post the conference. So we do a lot of things, but most of what we do is try to make sure that we are doing the work on the ground, but also looking at what the future is at the 40,000 foot level, and we really think that the Affordable Care Act is a unique opportunity.
So that's so impressive. So my final question is, you've been such a wonderful community leader. What advice would you give to other AIDS service organizations as we all try to move towards an AIDS-free generation?
As we move towards an AIDS-free generation, I think it's very important that folks understand that the future is now. The future is not kind of post-2014, that there's a relationship between the Affordable Care Act and an AIDS-free generation.
Great, Toni. So thank you so much for being here, and it's very inspiring to hear the work of Toni and her colleagues. And I'm Dr. Howard Koh at the International AIDS Conference in Washington, D.C.